This is not an assertion, but a fact, admitting of demonstration, as may be seen by a perusal of the foregoing table," end quote, referring to a table of 77 cases, in many of which the channel of propagation was evident. He adds, quote, "It is a disagreeable declaration for me to mention that I myself was the means of carrying the infection to a great number of women," end quote. He then enumerates a number of instances in which the disease was conveyed by midwives, and others to the neighboring villages, and declares that, quote, "These facts fully prove that the cause of the puerperal fever, of which I treat, was a specific contagion or infection, altogether unconnected with a noxious constitution of the atmosphere," end quote. But his most terrible evidence is given in these words, quote, "I arrived at that certainty in the matter that I could venture to foretell what women would be affected with the disease, upon hearing by what midwife they were to be delivered, or by what nurse they were to be attended during their lying in. And almost in every instance my prediction was verified," end quote. Even previously to Gordon, Mr. White of Manchester had said, quote, "I am acquainted with 2 gentlemen in another town, where the whole business of midwifery is divided betwixt them, and it is very remarkable that one of them loses several patients every year of the puerperal fever, and the other never so much as meets with the disorder," end quote, a difference which he seems to attribute to their various modes of treatment. Dr. Armstrong has given a number of instances in his essay on puerperal fever of the prevalence of the disease among the patients of a single practitioner. At Sunderland, quote, "In all, 43 cases occurred from the 1st of January to the 1st of October, when the disease ceased, and of this number, 40 were witnessed by Mr. Gregson and his assistant, Mr. Gregory, the remainder having been separately seen by 3 accoucheurs," end quote. There is appended to the London edition of this essay a letter from Mr. Gregson, in which the gentleman says, in reference to the great number of cases occurring in his practice, quote, "The cause of this I cannot pretend fully to explain, but I should be wanting in common liberality if I were to make any hesitation in asserting that the disease which appeared in my practice was highly contagious, and communicable from one puerperal woman to another," end quote. Quote, "It is customary among the lower and middle ranks of people to make frequent personal visits to puerperal women resident in the same neighborhood, and I have ample evidence for affirming that the infection of the disease was often carried about in that manner, and, however painful to my feelings, I must in candor declare that it is very probable the contagion was conveyed in some instances by myself, though I took every possible care to prevent such a thing from happening the moment that I ascertained that the distemper was infectious," end quote. Dr. Armstrong goes on to mention 6 other instances within his knowledge in which the disease had at different times and places been limited, in the same singular manner, to the practice of individuals, while it existed scarcely, if at all, among the patients of others around them. 2 of the gentlemen became so convinced of their conveying the contagion that they withdrew for a time from practice. I find a brief notice in an American journal of another series of cases, first mentioned by Mr. Davies in the Medical Repository. This gentleman stated his conviction that the disease is contagious. Quote, "In the autumn of 1822 he met with 12 cases, while his medical friends in the neighborhood did not meet with any, or at least very few. He could attribute this circumstance to no other cause than his having been present at the examination after death of 2 cases, some time previous, and of his having imparted the disease to his patients, notwithstanding every precaution," end quote. Dr. Gooch says, quote, "It is not uncommon for the greater number of cases to occur in the practice of one man, whilst the other practitioners of the neighborhood, who are not more skillful or more busy, meet with few or none. A practitioner opened the body of a woman who had died of puerperal fever and continued to wear the same clothes. A lady whom he delivered a few days afterwards was attacked with and died of a similar disease. 2 more of his lying-in patients, in rapid succession, met with the same fate. Struck by the thought that he might have carried contagion in his clothes, he instantly changed them and met with no more cases of the kind."